Welcome to the YouTube channel. I'll be telling you issues which HIV patients goes through. Do not forget, subscribe to the channel, like, and remember to wait for the next management of HIV, which will be coming soon. As I will quote this again, I will say it again. Scientifically, it's proven that people with HIV are not liable to die young. They can live, they can age. I have seen a lot of articles. People with HIV can live as much as they want to live. If you're having HIV, what are the issues, the most common frequent issues you should pay attention to critically? Number one, remember HIV cannot kill you instantaneously, but it is a disease that kills your immunity. If you remember when I was talking about the pathophysiology. So what can you do? Yes, you can pay attention to the causing, the opportunistic infections which are coming into your body, which can kill you. So remember, always protect your face because your immunity is less. You don't want, like the way I breathe in now, I can breathe in like this, I don't care. Because my immunity, my police officers are intact, they will take care of the issues. But you have to remember, put on face masks, especially when it's COVID-19 period, they say wear face masks to avoid spread of infections. It's very essential to remember that, and pay attention to your lungs and your cardiac and your bones. These 3 points. Pay attention to your psychology as well, because if you're depressed, you might commit issues or result in making yourself feel bad and you will not want to take your treatment. It's not good. Pay attention to your cardiopulmonary. This is because if you're having cardiopulmonary defects, 80 to 90 is too high. Let's say 60 to 70% or 60 to 80% of deaths of HIV comes from the lungs due to asthma. So you pay attention to that because the lungs take more infection than other part of the body, and the infections are the causes of death. Pay attention to that. Pay attention to your musculoskeletal system. HIV people are so lean. Do not let the issues cause you not to have good muscle mass and good bone density. Pay attention to that in aspect of paying attention to your dietary. Very essential. HIV people do not like to eat. I know, I understand how you feel in your lungs, you can't swallow, it's painful. But I'll give you a solution to that. Watch the management, I'll be talking about that. At the same time, pay attention to your kidney. Because the medicines you're intaking, the antiviral, if you're taking antiviral meds, ask your doctor to guide you, give you a good guidance, because most people having HIV, they have kidney issues due to the medicine is so strong and powerful. Kidney failures are there. Pay critical attention to that. If you're a female, pay attention to your vagina and your anal region, because there's more chances of bacteria. Like if you go take the bath, if the water is pouring, if the water is unclean, there's more chances of infection flooding those areas. Should pay critical attention to that. And I will not be forgetting, when I was talking about the dieting part, I told you I'll give you a solution, but pay attention to eat more so that you not have chance of developing ulcer. Alright, it's not a good idea. And still on that, I would say please pay attention to your blood vessels and your blood itself, hemoglobin. Most HIV patients have more chances of anemia. My management would give you a complete and nice way to deal with these issues which I'm telling you to pay attention to. My brother, my sister, you're having HIV, or your family member is having HIV and they use my management. You don't have to bother. I will quote this again, I will say it again. Scientifically, it's proven that people with HIV are not liable to die young. They can live, they can age. I have seen a lot of articles. People with HIV can live as much as they want to live. The only problem you have is that you can't flush it out from your system. They suppress your immune body. More you do some work and you push yourself to get better, the more better you would become. Watch my other video to know more on how to manage your HIV.